Kings and Queens, what's happening? I am back with you. I'm going to open the book on my results of my annual physical. I'm also going to share with you 10 reasons why you should get an annual physical every year. So no lie, full transparency, it's been a couple years since I had an annual physical, and I was in the midst of 2 transitions, moving. I never really got settled enough to find a primary healthcare physician. All right, it's excuses, but I have a pretty good approach about taking care of myself. But even as a person that exercises regularly, eats healthy on a regular basis, it's still good to get an annual physical, because you never know what's going on internal, even though you see what's going on external. They are not always indicative of each other in what you do and how you do them. So without further ado, here we go. New doctor, highly impressed by this primary care physician, by the way. Here are my results. I have negative hepatitis C screening, which is awesome. Normal vitamin D level. This is the first time ever in my life that I've had not my life, but my adulthood that I can remember, that I've ever had a somewhat normal vitamin D level. So yay to me. Typically I'm vitamin D deficient, which is common in people in the Black community. I think it has something to do with the darkness of the skin and the sunlight not being able to penetrate through as it does in lighter complected ethnicity. But don't quote me on that. Here's a big one right here: negative STD screenings. Now there are, so many of them out there. It's reassuring to know that you're clean. Even though you know that you're clean, it's good for the doctor to say that you're clean, because things go into your body and linger. And they wait for the right time, and they're like, gotcha. You thought I forgot about you, didn't you? And there are some things that I've never even heard of, like this trichomonas. I never heard of that. Gonorrhea, chlamydia, HIV, syphilis. Negative. My PSA level, that stands for prostate specific antigen. My diabetes screening is normal. Electrolytes, kidney functions, complete blood count, and cholesterol panel is all normal. Thank you, kale, and all the other green leafy vegetables. So for all of you all out there that say, I don't like vegetables, I don't like, it's hard for me to eat green vegetable especially, then you know who I'm talking about. You better get on it. This is gonna help the story be true to long live the king and queen, or kings and queens. So I did have one issue that the doctor is going to keep an eye on. That's an elevated liver enzyme. It's typically below 40. Mine is a 46. What she actually thinks is that it probably has something to do with the multivitamin that I take. So I'm going to send her a photo of the back of the label so that she can look at the ingredients and give me feedback on that. I absolutely love the care of this physician, that she cares on a level like this. Many physicians are like in and out, and I'll see you next year. So there are other areas within my physical that they also pointed out in the blood work, as far as sodium, potassium, chloride, creatine levels. You see what they are. So that's all of those things that, you don't think about on a day-to-day basis, but from a medical perspective, these numbers really make sense to be able to look into and look after. Now, here are your 10 reasons why you should get an annual physical every year. Well, number 1 is going to elevate your state of well-being, meaning that you're going to be aware. It's much better to be aware more than anything. There are things that could slowly creep into your body, and we all know somebody or some people, and they've been doing well all along, and suddenly they don't feel so good, and something has crept in, and before you know it, they had an issue. Like, for example, Chadwick Boseman, right? One of our beloved own, he had a cancer that, had he been screened for this in his late 30s, it could have been caught. Now, I know that there are levels to screening and when to screen for prostate cancer, any kind of colon cancer, cancers that may be hereditary in your family. I think there's never a time that is too soon for that. I mean, especially going off doctor's recommendations, at least meet that requirement at a minimum. Number 2 is it can also help manage your existing medications. So if you're already on medication and you are taking these over-the-counter drugs or prescribed drugs. You never know how they could hurt your body when you mix and mingle. Also, on the positive side, if you're exercising and you're beginning to eat healthier, you never know what pills or prescriptions the doctor may be able to remove from your diet, because some of you have pills lined up, right? Now, if that's multivitamin and fruit and all of that, I applaud you. But for some people, it's all things to help keep you alive. Doctors have a job to do, to medicate you, to subscribe you, and they're getting their big payout from big pharma and all of that. So your job is to take care of yourself, go see your physician, and maybe they will even remove some of those prescriptions from your diet because you will no longer need them. Number 3, you want to get update on vaccinations. For those of you that go, or even in this, kind of pandemic thing, a whole nother can of worms that I'm opening up right now. But so many of you are like, I'm not getting the vaccine. I'm going to wait and see if other people grow horns. All right. You mess around and not see another birthday. A whole nother story, I'm just saying, but vaccinations, we've been getting vaccinations as people from the time that we've been born. You need shot records for schools. You need certain shot records for jobs. And I don't think this whole thing that we're living in right now makes any difference. But vaccinations do expire. And certain countries, globally require certain vaccinations for you to enter and exit out of their country. So you want to make sure that that is up to date. Also, number 4, you're going to minimize healthcare costs, because guess what? If you can find something early and you can tend to it, then it's not going to be worsening. It's like go ahead and getting your oil changed on a regular instead of going and letting your engine blow and having to replace it for thousands of dollars when you could have went to Jiffy Lube for $19.95. You're also going to reduce your risk of disease. Disease is a big deal when you smoke, drink, heart conditions, diseases in your blood. When you're getting this blood work done, you're able to see what is lingering, what is in your system that you aren't able to see. Again, we all think we're fine until we're told that we're not. And I know this is a big deal for us, the C word, cancer. You can prevent cancer early. There are so many things. I heard a podcast this morning talking about a small pill-sized object that you can put in your mouth, swallow. This thing is going to go down into your intestines, take a 3D scan, and be able to give you a report of photos and a report of what your intestines look like. You can poop in a box and send it off to see if you have symptoms of colon cancer. All of the bodily fluids will tell you or indicate what's going on within you. Number 8 is it ensures proper functions of the body and its organs, right? Again, we've heard of people that had kidney failure, right? Heart failure. So the bottom line here is that getting frequent checkups can really be a good gauge to tell whether your organs and those parts are working properly as they should. Number 9, it gives you a great relationship that you develop with your physician, right? When you have a great relationship in any way, it is priceless to know that you can go to that person, but in this case, your physician, and know that they have your best interest at hand. You don't want to be getting on WebMD, scaring yourself. Anytime you WebMD something or you Google something, you think you're going to die immediately. Last but not least, you're going to update your medical records, right? If you ask yourself, when was the last time I did a visit to my primary healthcare physician, or what do my medical records look like, or when were the last time they were updated? Many of you would not remember. You probably say something, the last time I had my child, look, you better start putting yourself first, talking about, my child before me. Look, who's going to take care of the child if you're not here? That's what I want to know. Now get your butt on that computer or on that phone, schedule an appointment with your primary care physician. All right. Now, if you got insurance, this should be covered free of charge. You sitting on your do nothing, waiting, letting life pass you by, talking about how miserable you feel, all because you didn't go and get an annual checkup. Get your butt up and go get that checkup.